Hello, welcome to Lecture 5 entitled Management of Infectious Diseases. I am Dr. Marthony P. Basco, a pediatrician and member of the Philippine Society of Public Health Physicians. The objectives of this session are as follows. The learner should be able to recognize some of the common infectious diseases that may present in the school setting. The learner should be able to recognize and act on urgent signs for immediate referral or red flags for students with infectious diseases seen in the school setting. Now, what are the factors that may influence sickness in school? Crowding. When there are too many students and teachers in a room, the chance of getting infected when someone is sick is high. Lighting and ventilation conditions. Poor lighting and poor air circulation is also a factor in the transfer of illness. In addition, children have the tendency to play and interact with their friends, sharing school supplies and even food while they are in school. And lastly, parents want their kids to have perfect attendance. Therefore, despite being ill, they still send their children to school. These are some of the factors that may influence how sickness is transferred from one child to another. There are specific ways on how infection is transferred from one child to another. When kids place their hands or any item in their mouth, the fecal-oral route is very common, the cause of acute diarrhea and worm infestation. In addition, worm eggs are deposited in the soil, and children who do not wear shoes or slippers are at risk. Cover your mouth when you sneeze or cough, because oral droplets is the common transmission of acute respiratory infections, tuberculosis, measles, rubella, mumps, and chickenpox. Children with sore eyes or conjunctivitis and those with active skin lesions can transfer the disease to other kids by direct contact. Lastly, insects like dark and dirty surroundings, making them breeding grounds for mosquitoes that may carry the dengue virus and bite your child. As teachers, you get to observe the children's behavior and physical symptoms while they are in school. You can detect that something is wrong with the child when they present any of the following. Fever is a body temperature above 38 degrees centigrade. When the child is unusually quiet, weak, or refuses to join activities and play, then this is a signal that something is wrong. Sneezing, nasal discharge, coughing with or without phlegm are signs and symptoms. Itchiness of the eyes, red eyes with or without discharge, abdominal pain, vomiting, diarrhea, skin rashes, and pain on the ear or any part of the body may be a symptom that something is going on inside the child. It may be good to alert the child's parents and the school physician when you observe these symptoms with your students. Let's discuss about the actions that you should take when a child in school gets sick. The first thing that we should do is to isolate the child. When a patient is isolated in school, the room should have good lighting and ventilation facilities. The child should also be comfortable and safe inside this room. Patients with respiratory infections should be given masks to avoid the spread of illness. Water and sanitation is highly recommended. And when sending students home, it is important that students, teachers, and staff members remain at home for the duration of their illness to avoid further spread of any contagious disease. When a child has been isolated, symptomatic management or primary care should be instituted. School clinic staff, such as physicians and nurses, are equipped to provide remedies to help ease symptoms of most common illnesses in the school setting. These may include administering medications for pain and fever, as well as oral rehydration in cases of nausea, vomiting, and diarrhea. The sick child should be made comfortable and relaxed during his stay. The school clinic must provide instructions to parents and caregivers for home care or facilitate referral as needed. As public health advocates, teachers learn to gather information by investigating the case of a school child who became sick. With the help of teachers and other staff, the school clinic or health service must gather the following information. Who is the child? Is he known to be sickly or with comorbidities such as obesity, asthma, or malnutrition? Who are the people he got in touch with? Where is the classroom located? When did the illness happen? Was the affected person already feeling ill before entering the school? Did the child bring the illness from the home to the school? What happened before the illness? Was the child exposed to allergens, chemicals, food, or water in the school premises? Investigating the circumstances of the sick child will give us a lot of information in order to identify, manage, and treat the student. The last step that puts all things together is to develop a communication plan. A communication plan involves documentation of the incident. Proper forms should always be available. Documents should be available and accessible to school staff. The process of coordination in sharing the information to parents and school authorities for decisions and actions should be clear and systematic. A flowchart may help in this area. If necessary, local health authorities such as barangay or municipality should also be notified and involved, especially if an outbreak is being considered. Proper filing and storage of these information ensures that the data can be reviewed and referenced for monitoring and surveillance. Although many children's infectious diseases are readily treated with home care or may even resolve on their own, there are some cases that require urgent or emergency management at a hospital setting. It is crucial that school health staff facilitate referral and coordinate transport of students and other members of the school community who need this sort of care. Now, what are the red flags for emergency referral of students? Breathing concerns such as fast breathing, noisy breathing, labored breathing, or when the lips become bluish or the face becomes pale. Pain that persists or intensifies through time. Uncontrollable vomiting or diarrhea. Very high fever above 40 degrees centigrade with or without neck discomfort. An abdomen that is painful and hard to touch. An unusual rash that is sometimes colored bluish or violet. Neurologic signs such as seizures or convulsions, loss of consciousness, or change in alertness. These are red flags that may warrant immediate attention. Let's move on with a case. A teacher, Marites, reports that one of her grade 1 pupils, Teresa, has vomited 2 times in the classroom after recess. When Teresa was brought to the school clinic, she was irritable, feels warm to touch, and complains of nausea. She has a temperature of 38.1 degrees Celsius. Based on your learning in this session, how would you approach this case of Teresa? Please document your answer and share your responses with your groupmates.